Dr. Pejham, tell us a little bit about the cold and the sniffle. Time to go down to Walmart and buy a Wickwackaroop or something like that. And there's all that stuff out there. And I'm sure that some of it is very good and working. In fact, I want you to elaborate a little bit again. What can mom do to perhaps prevent it, or in most cases, when it slightly comes, to realize, oops, I better do something now, otherwise I have a couple of weeks of a sick kid here, and if I do something now, I might only have a day or two, never mind the restless sleep, not just for the child, but also for the mom. So what can and should be done there? What are some of those things? Again, throw him in hot water and drown him there, or what should we all do?
The good old remedies. So, what's been known to help with these kids, just the very beginning of sniffles. Of course, we have to differentiate. There are two types of sniffles that kids can get, just like adults. One is a viral infection that they may be catching. The other one's allergies. So a certain time of the year, sniffles could be actually allergies and not cold. That's a different topic. So let's talk about the sniffles that is just a minor cold. What's recommended for kids to have is good nutrition. That's a time that's, like you said before, the chicken soup is a powerful thing. All those vegetables, ingredients, provides with a bunch of electrolytes. It provides with vitamins. It's packed with nutrients that really help the immune system, and so have a chance to fight it off. So good nutrition and good amount of fluids, keeping kids really well hydrated makes a huge difference. We do recommend parents to do a few things at nighttime.
Can I interrupt you here? When you say hydrated,
sure.
Can I interrupt you? When you say hydrated, would a Coca-Cola be the same than a glass of water?
Of course not. This is we recommend our fluid of preference is water. Now the kids that are not eating, there are some electrolyte fluids such as Pediatric, or for older kids, they can get some commercial products like Gatorade perhaps, with a lower sugar level in it, called the G2, to rehydrate. And of course the only people who need these kind of electrolyte solutions really are the ones that are not eating. Anybody else should be just drinking water. And sodas, of course, are really bad for cold because the amount of sugar in there and all those artificial flavoring and coloring, they can just make things absolutely worse and not certainly better. But it is important to stay well hydrated with using water, of course, along with electrolytes in case kids lose their appetite and they need some nutrients to get some energy level. So back to the nighttime remedies that I was mentioning earlier. The humidifier, again, providing that moisture or warm bath, certainly before bedtime, but running a humidifier at night really does make a difference for kids to be able to breathe easier. It just doesn't allow that mucus in their nose to dry up. So it makes it easier for them to breathe through the night. It calms down their throat and cough. The other things that help is a good old remedy, Vicks, that we all grew up with. Just the menthol smell of Vicks helps kids breathe easier. We ask kids that are older than 1 year of age to be given some honey. It's been shown it's one of the most powerful natural cough suppressant for children, especially works at nighttime really well. We ask kids to be kept slightly elevated so that, again, they can breathe easier. And, of course, try to clear all this stuff out of their nose before they go to bed. So doing these simple 5 steps helps everybody get a better night's sleep. And hopefully it'll help the cold to have a shorter duration. And, again, we ask parents not to medicate kids as much as possible. These medications have a lot of side effects. And for children, especially less than 6 years of age, it's been shown to be very little to no effectiveness as far as their symptom relief is concerned. So the good old remedies still are working, and it's been shown to be much more effective than medication, especially for the children less than 6 years of age.
Wonderful. So what you're saying is that a Tylenol and an aspirin is, especially for young children in a flu situation, it has shown to be not all that well working. So you're better off with honey, with Wackaroop, with warm, humidifying the air so you breathe better, elevate the body so it's easier to do. There's not so much pressure on it, that type of stuff.
That's right. That's right. The cold and cough medicines really for the pediatric populations have been shown to not do anything for kids less than 2. And the label has been changed not to even have them available for those children, which they're used to be available. And between age 2 and 6, it's been shown to be very little to no effect. So all these children's cough and cold symptom relievers that are over the counter, we ask parents not to give their kids that, and certainly try the natural remedies, which are being shown to be a lot more effective. Those cough and cold medicines for older kids over 6 years of age has been shown to be slightly more effective. So we ask parents to decide what's best for them, of course, to use, but at least give the natural remedies a chance.
Right. Well, let me ask you just very fast here. If it hints to me that you're saying some of those colds simply come about or they can be helped out with good nutrition. So the question is, do we have a lack of good nutrition, and is that a potential reason that we get more colds than we otherwise would get? So if chicken soup helps out to get rid of, if honey helps to get rid of, if staying hydrated, drinking water and not the sodas and electro thing, if all that helps to get maybe rid of it or mitigate it in any case, wouldn't it be good to have it all the time? And is there a chance that we don't get it, and that's why we get this stuff in the first place?
Right. Well, in the United States, we're lucky enough to have a lot of food available at a reasonable price. So malnutrition is a cause of poor immune system and weak immune system, and certainly does happen in the U.S., not as much as in the third world countries. So malnutrition is a different story, and those are the times that certain supplements can really make a huge difference, especially to boost your immune system. But speaking of a child that is not malnourished, normally it's been shown that just taking extra vitamin C may not be that effective to keep the viruses at bay. But the well-balanced diet is extremely important. So again, staying away from the cookies and the candies and the cakes and having our vegetables, for example. So we need to get a rainbow color of foods in our system, helping our body get all the nutrients naturally, rather than trying to supplement with these vitamins in an artificial way.
Right, and that's what I was hinting at.
Chicken soup does.
Yeah, that's what I was hinting at. I mean, it's very obvious that very few people in America are really actually undernourished, but misnourished may be a different thing. Like, for instance, we talked about the chicken soup a little bit, and there is probably a difference to picking up that, and I'm not against the Chinese here at all. There's that Chinese soup, but there is no real chicken in it. There's nothing in it. There's only chemicals which give it the flavor. So that's probably a different thing than mom actually taking a few chicken legs, putting it in the water, and cooking it, because that's what would make a chicken soup.
And of course, homemade stuff goes a long way, but the stuff that you buy in the store, the problem is that you use excessive amount of salt for flavoring and for shelf life. And that's where the problem lies, because a child that may be slightly dehydrated already needs extra fluid with a little bit of salt, not the other way around. So it is important to, if at all possible, to make this more of a at home rather than buying it with a prepared processed type of food. But it is a great mixture of proteins and vitamins and vegetables. So for kids that are maybe losing their appetite because of their cold already, it really packs a very healthy dose of nutrients, which should help their immune system stay strong.
Thank you very much, Dr. Pejham. Thank you very much.